morning.
Good morning to
Hi,
you too.
my name is Agnes. How are you this morning?
I'm doing fine.
Oh, sure. I'm here to do your baby's head to toe assessment. Is it the right time for you?
Yes.
Oh, good. Thank you. So, I wanna, first of all, I need to wash my hands again. Put on my gloves. So, how are you? I mean, how did you sleep?
Okay.
Yesterday you were so tired.
I know.
How is the baby?
She's doing fine.
Oh, what a joy. So, I'm going to compare the bracelet of the baby. What is the baby's name?
And
No, date of birth is today. That's wonderful. She's sleeping. Let me wanna check also on your wristband. Yeah, I have the right patient. That's good. So what you're going to do about the head to toe assessment, I'm going to look at the normal findings that are supposed to be there for a newborn, and the abnormal as well. I'll do some teaching whatever as we go down. So if you have any question, it's okay to stop me and ask a question. If you have any anything you wanna say or you wanna ask, that will be appreciated. Okay, so since the baby is sleeping, I wanna start from the least invasive assessment, so that she can give us ample time to do the assessment. So what I'll do, I'll start with the respiratory. With the respiratory, I will check on how the baby is breathing, checking at the fall and rise of the chest. Normally, newborns breathe through their nose more, and also the abdomen, the belly breathers too. So Amy today, I can see she's breathing. I have to count the respiration on the belly, rise and fall, for 1 full minute. Wonderful. It is 35. Normally the respiratory the range is between 30 and 60. And for the abnormal, if the baby is nose flaring, is having sternal retraction, that means is having a difficulty respiratory distress. But for the baby here, our baby is good, is breathing okay, it doesn't have any distress. So I'll go ahead and listen to the lungs. I listen to the lungs. Since this is a regular stethoscope, I will use the bell side. I will listen from both sides, compare it on the sides. So no adventitious sound. There are no croakers. There are no wheezes. The baby is breathing good. Usually, if you can. At times there are some who have the fluid, you can hear it in the stethoscope, but for her, she's breathing very good, which is wonderful. So I will also go ahead and listen to the heart. Using my bell, I'll listen pulmonic, aortic, air, tricuspid, and the mitral. On the mitral valve, which is between 4th and 5th intercostal muscle, I listen to the epic pulse for 1 minute, full 1 minute. Wonderful. According to the canvas, the the pulse is 135, which is good. The range is normally 110 to 160 for newborn babies. So she's doing all well. And as I looked, the skin is good. She has no jaundice, no rashes. So I will start from the head to the toe. So I will look at the head first, check the frontal frontonal, the anterior frontonal, the posterior frontonal, the sutures. I see the sagittal suture, the coronary suture, all is good. At times you'll see they have the frontonal here, swollen frontonal, sunken frontonal, but at times they have what we call caput sarcodoma. That is something that resolves in a few weeks, and this is caused by, when the baby is born vaginally through the forceps, when it's, when they are being born at birth. So, but it goes away, it doesn't take long, and it doesn't have any effect. At times you'll see cephalohematoma on the side, which does not cross the sutures. That also is, bleeding underneath the scalp, which also resolves within a few weeks. That is very normal. So, but our baby here, she's looking great. The hair, the color is matching the ethnicity as well. So when you look at the face, look at the ears. I'm looking at the ears, both of them, they are all well formed. Sometimes you might find, so it's good to check both ears. Sometimes you might find you have one ear which did not develop well, and the other one malformed. So it's good to check. I can see the ear tag. If there is any ear tag, skin tag, you need to document it. And also from the eyes, I can draw an imaginary line to the ears to see if they are aligned properly. At times, if the ear is below, it's not, along with the ear, it cannot form the 90 degrees on the side like this. So that means that is an abnormality. So, but for Aimee, I think I see everything is good. So with the baby's eyes, the baby's eyes, compared to the, to older babies, when they are little like this, the eyes will be glaring, going really fast. That is very normal. So, and most of the time they are closing their eyes at this age. So I need to dim the light. It's not good to force the eyes open. So it's good to dim the light and use the light dimmed for assess for accommodation, assess for the reaction. Once you dim the light, they'll open their eyes so easily, which is good. So watching on the nostril, on the nostrils, you have to check for the patency, including one nose, since they are nasal breathers. The other nose will also, when you occlude one, the other one is breathing well, so that means it's patent. So with the mouth, we also need to check on these reflexes as we go along. So with the mouth, I will insert the one finger in the mouth. This time I'm checking for the cleft, I'm checking for the hard palate, I'm checking for the soft palate, and checking the sucking reflex. And the baby is really sucking well, which is wonderful. So with the rooting, I'll put my finger on the cheek, then the baby will follow the finger, trying to suck, trying to look where it, which is good. That means the baby is good. So coming to the shoulders, on the clavicle, we have to check if the clavicle are symmetrical. At times you'll find they're not aligned, they are not the same. You'll find one is lower, the other one is higher. That could mean, that will indicate that there's a shoulder dislocation, and it normally comes from the shoulder dystocia. You know, there are babies who come out through their shoulders, but for our baby here, the clavicle is symmetrical, which is good. So going down, as I checked for the, before I forget, I need to check on the brachial pulse, symmetrical, it's strong and pounding. Check on the femoral, which is strong and pounding. Comparing both sides, it's all good. So also checking on the reflexes as I'm going down. Checking on the reflexes, I hold baby like this, leave her down, she'll form like a C. That is a moral reflex. That means the baby is good. When they're just flaccid all the way, either they're immature or they have some abnormality. So for her, she's doing good. If I put my finger here, the hand grasp when she folds in, holding me, that is great. She has 10 fingers. She has 10 toes, 1, 2, 3, 4, 5, 6, 7, 8, 9, 10. At times other children have an extra finger. There are some which can be treated right away. There are some which have to go for surgery depending on how the extra finger is. So, but for our baby today, she's quite fine. She has 10 fingers, which is normal. She has 10 toes, which is normal. So when this is done, so we come to the belly, coming back to listen to the bowel sounds. The baby who is, you know, a newborn, when you listen, normally the bowel are present within 2 hours or so. Once they start feeding, the bowel becomes present. So listening clockwise on the 4 quadrants. Wonderful. The bowel sounds are present, which is good. The belly is round, soft, so she doesn't have any problem. Coming to the cord, when we look at the cord looks good. It has 2 arteries, 1 vein, which is good. And also how to care for the cord. Mom, you need to do not soak the baby in the water, just sponge bath around it, and it will fall off, you know, within 8 to 10 days. So the main thing we need to watch for this is infection. Otherwise, it's easy to take care of. Okay, so we will also check. So how many times does the baby feed for you?
Every 2 to 3 hours.
Oh, that's wonderful. That is expected, and that is what you expect at this age. At times they demand more, but you know, that is expected, which is good. So looking at the diaper, if she's a girl, our baby is a girl, I look at labia minora, labia majora. Since it's a mature baby, both of the labia and the minora and majora, they are both there covering the clitoris. So, and at times you'll find the white stuff along the vaginal folds. That is perfect normal. And look at the diaper. Did she have a BM for you?
Yeah, it was some kind of weird looking.
Oh, yeah, you know, that is called meconium. It's also, the baby passes that meconium between 24 to 48 hours. So that is nothing to worry. You know, now the bowels are, you know, the system is working. So those are the first tools for a newborn. So, and also if you see any colored, you know, any any colored blood changed in the diaper. That is totally normal. That is from the hormones from the mother still passing on to the baby. So that is nothing to worry about. And if this was a baby boy, you know, baby boys are being circumcised. Uh, if the, you know, depending on the parents, if they want it, they can do circumcision, which is okay and it's allowed. So we'll teach the mother, we'll teach the mother how to take care of the baby. Do not immerse the baby in the water, you know, clean around it just with water, and do not moisturize the place if there's, you know, bleeding. You know, you need, if the baby is not urinating after circumcision, something is blocking, you need to report it right away. So, and for the boy, if it's a baby, it's a male, if it's a male, also you have to feel the testes, which should be descended. When, if the baby is mature, they are descended. When you touch them, they are like two marbles down there. So if you feel them, you feel them. That is a good assessment to do. But this is a girl, she's fine, everything is normal, she has a good. So how many diapers do you change in a day?
7.
Oh, 7 is good. 6 to 8 to 12, 7, that's not a bad number, which is good. So from there, I'll turn my baby, check on the back, look at the, you know, look at the curvature, look at the spinal, if it's straight, flat, you know, if it's aligned. For her, everything is okay. Check on the sacral dimple. At times that might indicate you know, tubal defect or something abnormal. That must be reported and that must be documented as well. At times other babies have what we call Mongolian spot. Mongolian spot is okay for colored babies. It also resolves in a few weeks. So as I'm looking, I also look at the gluteal folds. The gluteal folds should be symmetrical. If they are asymmetrical, that will indicate hip dysplasia or hip dislocation. So that also needs to be recorded. So going back to the head, I talked about the frontonel and the sutures. They are normally not fused right away. They fuse down the line. I mean, it's not right away since it's still a baby. So from here, I will weigh my baby. Or before I weigh my baby, let me check on the head circumference while she's in here. I will put the head over, you know, the eyebrows, which is around, the head circumference is around 32 to 36 centimeter. She is 34.5, which is good. I will also go ahead and do the chest circumference above the nipple. Yeah, the chest circumference is 32 to 33 centimeter. She is at 31. That is 12 to 13 inches. She's around 13 inches. That's good. So I will also measure the height and weight. The weight, I'll take my baby. I have to zero the scale before I put the baby on. make sure the baby doesn't have a wet diaper. The diaper has to be clean, just the diaper without other clothes. That's why we undressed the baby. There you go. The baby is around 2 kg, which is around, it's normally between 5.5 to 8.8 pounds, which is good. Oh, also, let's measure the height. I have to pull straighten her up. She's around 45, the range is supposed to be 45 to 55 centimeters, around 12 to 18 inches. Maybe that tall. So this is around 19. She's quite a tall baby. So that is wonderful. She's trying to wake up now. Maybe she wants to feed. When was the last time you fed her?
Well, she's quite fine, okay, right now. Just let her sleep.
Oh, okay. All right. So I hope she'll remain the same. She's such a quiet baby. Oh my God, that's nice. Thank you very much. I'll perform hand hygiene and head out.